Welcome to Real Vermont News. Today, we're looking into why New Hampshire and 11 other states have eliminated the requirement for healthcare providers to get a certificate of need from state regulators before they can offer a new service or expand an old one. Why not let consumers decide if they want another MRI or a storefront medical office in their area? Here's correspondent David Fleming with a report.
Thanks, Bob. The theory behind these laws sounds great. Keep the number of providers and services down so that Vermonters don't have too much of one kind of medical service and not enough of another. But what really happens when regulators say things like the state can only have so many MRI machines is that the law of supply and demand means the price of an MRI gets inflated and we or our insurance company have to pay for it. Hospitals do that to cover the cost of something that loses them money, like a visit to their emergency room by a Medicaid patient, which the feds reimburse at a fraction of the real cost.
So that means that neither the price of an MRI nor the cost of a visit to the ER have anything to do with the actual cost of providing those services. Somebody in government must think they're smart enough to keep track of all this and make it come out all right. But as I look around, I don't see things turning all right at all. How much better off would we be without this level of government interference in our health care?
We'd be a lot better off. According to a 2016 study by the Mercatus Center, if Vermont had not adopted certificate of need laws back in the 70s, we'd have access to 36% more MRI machines and 37% more CAT scan machines. Without these laws, each Vermonter would have consumed $228 less every year in health care, a total savings of over $141 million, and that would lower our health insurance costs. Doctors and administrators would have a lot less paperwork as well. They could focus on patient care and charge patients less. Bottom line, a full repeal of Vermont's certificate of need laws will make Vermonters healthier and leave them with more money in their pockets.
Whew. If we'd let government design telephone service like they want to design healthcare, we'd still be looking for the nearest phone booth. Thank you, David. And if you're bothered by Vermont government's failure to let the marketplace increase quality and lower cost, like the marketplace did with telephones, then like this video, click your Facebook share icon to tell your friends all about it, and tell every legislator you meet that you don't think government control of healthcare is working well, and we can start improving things by repealing certificate of need laws. And that's all the Real Vermont News we have time for. A lot more happened, and we'll be looking into all of it.